we say in Judaism, if you save one life, you save the world. So I think this is a very important point related to my background, because that's what really drove me to make molecules that can save lives. In 1983, we realized that AIDS was a virus that can kill people. People were dying in front of our offices, literally in front of our offices. People were very sick, and it had a major impact on me to develop drugs that could be useful for the treatment of HIV. That drove me to set up the first AIDS lab at Emory University, the very first one. And believe me, it was not easy at the time to get all the regulatory and get even my bosses to agree to set up a lab. But in spite of that, we set it up, and we started screening immediately molecules. In a way, with my background from all the way from Egypt to Emory, through England, through Yale, all this was knowledge that I acquired almost specifically to tackle this problem of HIV. It's quite amazing. The company was formed in 1996, and this company was actually eventually acquired by a bigger company called Gilead, specifically because of the asset that we had invented. Today, that asset is known as FTC, or emtricitabine. It's one of the most widely used antiretroviral agents on the planet. It's extremely effective. There was another related drug called 3TC, lamivudine, which also came out of this research. Again, one of the most widely used antiretroviral agents. And the earlier compound that we developed in collaboration with my old mentor at Yale, Dr. Prusoff, D4T, stavudine, that compound actually became a drug widely used all over the world. And even today, it probably is the most commonly prescribed agent in Africa, for example, for the treatment of HIV. The rewards have been enormous. First of all, my satisfaction in terms of saving millions of lives, literally 3 or 4 million people, and continue to save these lives, not only for adults, but also pediatric AIDS. And also people who are suffering from hepatitis B. Now we put a stop to the development of hepatocellular carcinoma. So these drugs actually are useful for the prevention of cancer of the liver, which is a major problem. These patients will never need a liver transplant if they take these molecules. I think we have a tremendous talent in Georgia, and we have all these wonderful institutions that have amazing scientists working in Georgia. When I heard that I was being honored by the Hall of Fame of Georgia, being inducted, I was extremely excited, because it's sort of a culmination of what I've been able to do in Georgia. But hopefully what I've done will spin off numerous other companies in Georgia that will be useful and create innovative technology to help mankind in the future. I think this is what it's all about. It's about saving lives. It's about the pursuit of happiness. It's about creating molecules that reduce the suffering and the misery in this world, not just in Georgia, but even beyond Georgia. So I'm extremely honored to receive this award.